just coming on to some more specific questions. So this one's on personal protection equipment, PPE, specifically the guidance around it in the NHS. So I've been contacted by many health professionals, patients about this issue in particular, worried that the people who are treating them are wearing the right stuff or protection for themselves. So somebody asked whether everyone should be wearing FFP3 and eye protection in all care in hospitals and in the community.
So I think we've got to be a bit clever about this, because the risk for the infection spreading is different in different settings, okay? So in some settings, for example, in a dental practice, or maybe in a hospital where they're doing a procedure that involves putting a camera down someone's throat, for example, yeah? Those procedures are what we call aerosol generating procedures. So they're quite high risk because it generates a lot of aerosols that might carry virus. And in those settings, of course, you definitely want your healthcare workers to be wearing the best FFP3 masks out there, and visors and everything else that will protect them. But in other settings, it might be a waiting room, it might be a reception area, for example, the risk is a lot lower. So rather than everyone wearing the top level protection, we can tailor the protection that people need to the setting. And that's also true in the community, and that's also true in general practice. So you'll tend to see a lot of our healthcare workers wearing personal protective equipment that is tailored to their setting. Now, I think early on in the pandemic, we didn't really know enough about the spread and the risks. So there was a little bit of confusion at the start, but certainly now we know a lot more, and many of the professional societies like the Infection Prevention Society, the Healthcare Infection Society have all given a lot of good advice, and a lot of healthcare workers these days are following them. So it's a degree of reassurance I'd like to give to members of the public that, especially in healthcare settings, you will find the healthcare workers are following the rules.